As a family nurse practitioner, we are able to see everyone from birth all the way until death, so all age groups. We take care of all diagnoses, from minor things to complicated things. In high school, I was a nurse's aide at a nursing home, so I've got a great passion for the elderly geriatric group. I lived right next to my grandparents, so very much enjoyed visiting with them, somewhat taking care of them, but just enjoyed that realm of life. So being in the nursing home, I think definitely put me into like the caregiving role. Somewhere in there, I also started to really like kids. So I guess family practice is a good place for me because it, again, goes from kids all the way to adults to geriatrics. It's a brand new patient. I ask them what their goals are or what I can help them with today. Ultimately, I'm not there to scold them or bring them down in any fashion. My goal is to help them the best they can. My job is to give them recommendations and what I think is going to help based on medical science and what I have knowledge regarding. It's always up to the patient to take that information and utilize it in their home. We're here now in this facility about 1.5 years. It is a wonderful facility, obviously brand new, state-of-the-art equipment. A lot of our physicians work both hospital and clinic. As nurse practitioners, we're primarily into the clinic, but it really helps patients to see their own physician, their own care provider when they're in the hospital. Also for OB care, it's wonderful as physicians can go back and forth easily, check in on their laboring mothers, and having the ER right next door if we're seeing someone in walk-in clinic or family practice. It's easy to get them over to the ER without having to get an ambulance to, essentially before we had to just take them across the street in an ambulance, and now it's just a wheelchair ride. I have 5 children, so we always go around and do our highs, and when I come home and say, oh, it was a good day, and they're like, why was it a good day, Mom? Generally my answer is like I had a good conversation with lots of my patients. Everyone was willing to work together. I feel like I really helped somebody, figured out a situation that they needed help with, so that they can go home and feel better, figure out some new diagnosis and then an effective treatment for them, or got them to the appropriate specialist, or got them the care that they needed.